Thanks for joining us here on the Arizona Daily Mix. I'm Angela Scott, filling in for Sandy Moss. Now, we don't like to think that a stroke could possibly happen to us or someone we love, but it can be preventable somewhat when you learn risk factors. Joining me today is Karen Russell, the community liaison for Mountain Valley Regional Rehab Hospital.
Hey, you did it!
That's
nice
a long
job.
one.
That is a
But
long
you're
one.
from Mountain Valley Rehab. Thanks for joining us today.
Yes, thank you for having me.
So it is National Awareness Stroke Prevention Month.
Correct.
And prevention is key, right?
It is. One of the things we're focusing on this month as far as stroke awareness and prevention is women. Women are at a higher risk for stroke. What a lot of people don't realize, it is actually the third leading cause of death among women.
So why? Why particularly women?
Women have a lot more different physical issues, so when it comes to reproductive health, hormones, pregnancy, childbirth. Another big one is contraceptives. They can double the risk of a stroke. And then later on in life, women that go on hormone replacement therapy, HRT, that also increases your risk of stroke.
Do we know why?
I know as far as the oral contraceptives and the HRT, it increases your risk of blood clots. So anytime you start developing blood clots in the lower extremities, once those clots dislodge, they can travel anywhere in the body. They can go to the lung and cause a pulmonary embolism, heart attack. If they go to a brain, it causes a stroke.
So what can we do to decrease these risks?
A lot of it is just healthy. So you want to monitor things like blood pressure, cholesterol, your weight, your exercise, check for diabetes. Diabetes increases your risk, and smoking. Smoking is a significant increase in risk factor.
Yeah, it's a biggie. And you know, I was reading that 80% of strokes may be preventable.
Yeah, a lot of it is, especially nowadays, our diets are not very healthy. They're not very good. They're very high in sodium. Sodium increases your risk for high blood pressure. What happens with high blood pressure is it damages the arterial walls. So when you get that damage, not only are you weakening the arterial walls, so it increases the risk of a rupture, but that damage also makes it easier for blood clots to form. And so when you start to get blood clots forming, that's going to put you at a higher risk for stroke.
So Karen, what exactly is a stroke?
Stroke is any time that blood is deprived from the brain. So typically it's in two different ways. One is an embolic stroke, which is typically a blood clot, but it can be any type of an embolism. It can be an air or a fat embolism. The other type is what we call the hemorrhagic stroke, and that's when blood starts to leak from a vessel or a blood vessel bursts. But either one of those, you're not getting circulation, so you're not getting oxygen to the brain.
And so then it generally affects one side of the body.
Right, so it's going to affect one side of the body generally, and then depending on the part of the brain that is damaged, that's going to tell you what kind of deficits that you may have.
Now, are people genetically prone to strokes?
They can be, just because certain ethnic groups are more prone to high blood pressure and diabetes. So just in that fact, yes, they would be at a higher risk for stroke.
And you have a free stroke awareness fair coming up.
We do. This is our second annual, and so far we're getting a pretty good response, even though it's still early. Saturday, May 19th, we're having a free stroke awareness fair. It's from 9:30 to 2. We have a lot of different fun activities. We have 3 really great speakers, one of which is from 11:30 to 12:30. Dr. Mitchell Gilbert, he is a licensed neuropsychologist, and he's going to talk about emotional recovery after a stroke. So things like depression, pseudo affect, those type of things where a stroke, people don't realize it affects emotionally and psychologically. So we're going to have that. That's a free lunch and learn. So that is one of the only parts of the events that we're asking for a reservation, because we need to plan accordingly, according to how many people would be there.
Okay, is this taking place at Mountain Valley Rehab?
It is. It's going to be at Mountain Valley Regional Rehab Hospital. We're going to have stroke risk assessments, so we're going to have nursing there. They're going to do blood sugar checks, cholesterol checks, blood pressure checks.
So great.
So all those wonderful things they're going to check to see what risk you are for stroke. We've got therapists involved. We've got free balance testing, free cognition testing. One of the most important things I really want people to pay and maybe participate in, not pay, but participate in, is our pharmacy consults. We're going to have a pharmacist there, and it's really important to have a medication reconciliation, so a pharmacist can sit down and look at your medications and see, are you duplicating things? Are you on things that maybe you don't need to be on?
That's so true, because oftentimes doctors miss certain things, right? They're human, so they're not looking at the entire panel of meds that someone may be on.
Yeah, and especially as we get older, we tend to have multiple physicians involved. We have specialists, so they're generally not seeing all of your medications. So it is really common that you might be on 3 different blood pressure medications and you don't need it.
Right, exactly. Well, good. Thank you so much. Thank you for educating us today on this.
Yes, thank you.
Yeah, so that sounds like a great fair. Make sure you check that out. Prevention is definitely key when it comes to stroke or anything medical, absolutely. Thank you for joining us here on aztv.com, and we'll be right back after the break.